The Mpumalanga Department of Health is launching a clinic-based approach to try and tackle COVID-19 and prevent fatalities in Mkhondo, Mpumalanga. The aim is to pay attention to those living with chronic illnesses that may be underlying factors which contribute to the cause of death in COVID-19 patients. Let's get more on the story now. We crossed our reporter Siphephile Kunene in Mkhondo. Very good afternoon to you, Siphephile. Tell us more about what's happening.
Morning to you, to Zinga. What's happening here is that the Department of Health in the province is launching a program that aims to look at how to assist those with chronic illnesses that attend clinics where they get medication and all. They are moving the approach towards fighting COVID-19 from the wards to the clinic so that they reach the grassroots levels. With me here is the MEC of Health, Sekani Manzini, who will explain exactly how this will pan out and what it entails.
Thank you very much, and greetings to the viewers at home. As a Department of Health in the province, we have seen that there is a program that was launched that is ward-based, of which is a very good program, but we want to take it down to a clinic level. Hence today we are launching a clinic-based approach where we want to use the data that we are having at the clinic level to be able, because in the province with the low numbers of infection that we are having, we want to prevent more people from being infected. We want to cap the spread of this virus of COVID-19. Hence today we are here. Want to take the data and see those patients that are at risk, that we know that if they can be infected with this COVID-19, we can lose them. Hence, we are saying we are going to work with your community health workers to have targeted screening in terms of your elderly, those with chronic diseases, and all those with comorbidities, using the data that we are going to have from each and every clinic, so that the communication, working together with your traditional leaders at the level of the clinic, your religious leaders at that level, also traditional healers, so that we have an approach that is going to make sure that in terms of communication, in terms of working together, we can be able to cap the spread of the virus. Hence we are here today to say that we want our people to care about their health status. I think COVID-19 in a way brought something good, because now we want our people to be able to know that we want everyone at a clinic level to know their health status. Those that are sick, we want them, a chronic patient, to continue to take their medication so that in case if they are infected, they are stable. Want them, as long we know that nationally we are saying elderly people must not go out, they must remain at home. But as a province, we want to take it further to say even those with comorbidities at the level of a clinic, we are going to monitor them and talk to them to say how important it is for them to prevent themselves from being infected by the COVID-19. So that's why we are here today. We want the approach of the primary health care, where our people, previously we have seen that as a province, when we report, we're also reporting in terms of the screening that's happening in our facilities. People do visit our facilities, but we want to increase that to be specific in terms of preventing our people that are at risk from being infected by the COVID-19. Hence, we are here today.
Is it going to be a program that will roll out throughout the province as you are launching here today?
Yes, you are correct. We are just launching it today at Mkhondo local municipality, but this is a program that we are going to enroll in all our clinics at that level, because we want our people to know exactly what is the COVID-19 and how can you prevent yourself. So this approach, we want to launch it because it is at a lower level, at the ground, where it's easy for our people to understand what we're talking about. Hence, I'm saying the stakeholders collaboration, where people are engaging on a daily basis. For example, Mpumalanga is a rural municipalities. We work with indunas, where each and every weekend when they are having funerals, the message that we want them to communicate, the religious leaders, the message that we want them to communicate. So wherever you are in the province, we want to take an approach of preventing, and there's no best way than to do it at the clinic level. And further than that, we want a clinic to know economic activities around that area. What do I mean by that? We open your saloons, we open certain economic activities at a local level. They should be able to have a team that will also monitor compliance, so that at that level of a clinic, we don't get the spread of the virus at that level. So we are seeing this program that they're launching today, it is going to assist us because that's where people are, that's where people are interacting on a daily basis. Hence, we are launching this program today.
MEC Mpumalanga is vastly rural, like you have mentioned, and in some cases there's farms, and there are places that do not have clinics, but there are mobile clinics that visit them. Do you have a plan for those too?
Yes, in terms of mobile clinic, you know that we do have got patients that are taking medication at that level. So we do have a data in terms of knowing exactly in these different farms how many people are visiting our facilities and how many people are having these comorbidities. Hence, we'll work with, hence I said, in each and every part. Mobile clinic is part of our approach that we're going to use and make sure that those that are vulnerable, those that are at risk, are not infected because we don't want to lose more people in the province. That's the approach that we're going to take, working with the different stakeholders in the province.
Thank you so much, MEC, for your time. That was the Mpumalanga Health MEC, Sasekani Manzini, explaining that the aim is to reach every corner where there is someone living here in Mpumalanga. Now they're targeting even farms where we've seen in the past that they were struggling to have clinics, but they are going to get there in order to address and make sure that the numbers do not increase. You'd understand, Zinga, that Mpumalanga only has one death so far that has been attributed to COVID-19, and that came from the Mbombela municipality. With the numbers growing in Mpumalanga, the growth of the numbers is not so high because when they discover a case, they rush there. There's a team that is sent there to do follow-ups and find all contacts so that they can contain the disease, Zinga.
Siphephile Kunene coming to us live from Mkhondo and Mpumalanga there. Let's continue taking a look at COVID.